Hello and welcome to page 59 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Muscles of the gluteal region. There are three gluteal muscles: Gluteus Maximus, Gluteus Medius, and Gluteus Minimus. Starting from the most superficial or outer layer or outer muscle is the Gluteus Maximus right here. Very large muscle in the posterior ilium, originating from this point right here, the posterior superior iliac spine, the PSIS, as well as the lateral border of the sacrum. You can see that right here. And inserting down into the what's called the iliotibial tract, which is a very strong fascial connective tissue, like a long tendon type structure on the side of the leg. But not only does it insert there, it also inserts on the femur, the shaft, the upper proximal femur right here. So you can imagine and you can see how the muscle connects from the sacrum to the femur, like so. And of course, here we have the drawing, the actual drawing. And here's the Gluteus Maximus here as well, from the lateral view or the side view. The job of the femur, of the Gluteus Maximus, the action, remember we talk about origin, we talk about insertion, we talk about action. The action is to extend the hip joint, extend the femur backward in this direction. It also, looking from its position here, you can tell from this angle here that if the muscle pulls in this direction, it will externally rotate or laterally rotate the femur and at the hip joint as well. And it has one more action, one more clever little action, and that is adduction. It's going to bring the femur inward. So it's going to rotate it around, it's going to extend it back, and it's going to bring it in closer to the midline. And back. All three of those actions. A very big, powerful muscle of the posterior chain. And let's draw that here. Okay. So, origin. The posterior superior iliac spine, the PSIS of the ilium. The lateral border, lateral crest of the sacrum. Insertion. The posterior proximal femur. Next up is the Gluteus Medius. And there are three gluteal muscles, and Maximus, Medius, and Minimus. Of course, their names say it all. You go from biggest Maximus to smallest Minimus. So we'll deal with Medius, the one in the middle. And there's you see a little peak of the Gluteus Medius right here. It is on the side of your hip right here. And here it is cut away. You can see how it originates from this iliac crest right here. And actually in the iliac crest, in the ala or the wing of the ilia, the ilium. And its insertion point is right here on the greater trochanter of the femur. So here it is cut away here and inserting on the greater trochanter of the femur. And it's cut away in order to see the other muscles underneath. Here's another view of it right here. The Gluteus Medius muscle inserting on the greater trochanter. And what would the action be? Well, the action would be abduction, taking the hip and the femur, taking it sort of away from the body, from the midline. And it also medially rotates or inwardly rotates the femur. You can imagine if there were, you can imagine these fibers right here, if they contract and they pull this direction, this femur is going to pop out over here. The Gluteus Medius is also responsible for when you balance on one leg, you put all your weight on one leg. It keeps your hip, your opposite hip, from dropping down. It holds you, your body and your hip, in the balanced position. It enables you to pull one foot off the ground and hold it up there. Imagine that this person right here is standing on one leg, right here, standing on this leg. When they lift this leg up, this hip would drop down, except that the gluteus medius on this side pulls the hip over and keeps this hip, the hips nice and level when standing on one foot. Next, we have the gluteus minimus. Gluteus minimus is the smallest of the gluteal muscles, and here it is underneath the cutout of the gluteus medius. It's this smaller muscle right here, also attaching at the greater trochanter. So the origin here is on the ala of the ilia, or the wing of the ilia, and inserting at the greater trochanter. Very similar to the gluteus medius, its action is abduction. It pushes and pulls the femur away from the midline. That's in this direction. This direction. It pulls the femur away from the midline. And it also helps in standing and leveling the hips when standing on one leg. As you can imagine, if these fibers start pulling, they're going to pull in this direction, kicking the hip out this way. One more action, they also happen to be involved in a little bit of internal rotation. Internal rotation, turning the toe inward, turning the femur, the leg inward. And taking a step back and coloring in the Gluteus Maximus here, which was cut off, and its insertion point right here on the shaft of the femur. Next, the tensor fascia lata. Tensor fascia lata. This muscle is more on the front of the hip than anything. The front and the lateral side, certainly not posterior. But here it is right here. It's this small muscle that connects into the iliotibial tract right here that was discussed earlier. Here's the tensor fascia lata sort of cut away. Here's the iliotibial tract. Let's make it a different color. Make it a highlighter. This tract, this band down the side of the leg. And the tensor fascia lata originates right here at the anterior superior iliac spine, just lateral to the spine itself. On the and lateral to the crest of the ilium and the anterior superior iliac spine. The job of the tensor fasciae latae is to flex the femur, flex at the hip joint, to sort of kick the femur forward. It also is involved in internal rotation along with the Gluteus Medius and the Gluteus Minimus. So the tensor fasciae latae does not have an insertion on a bone per se. It doesn't come down and insert on the greater trochanter. It inserts all the way down into this right here, down into this what's called the iliotibial tract. The iliotibial tract. Note how the tensor fasciae, both of the tensor fasciae latae and the Gluteus Maximus both insert into the iliotibial tract, making the iliotibial tract very important and powerful in locomotion, human locomotion, gait, walking, and running, and standing. The piriformis muscle, now there are, outside of the gluteal muscles, the next layer down is the deep lateral rotators, starting with the piriformis. You've heard of the piriformis possibly because of piriformis syndrome. Here's the piriformis muscle right here. You can see easily why it would be a lateral rotator, why it would externally or laterally rotate the femur at the hip joint. Sciatic nerve, here's right here running underneath. And why you've heard of piriformis possibly is because sometimes if it's inflamed, that side will press on that sciatic nerve, or if it's tight, sometimes the sciatic nerve even pierces through the piriformis muscle and can cause complication and pain, numbness, and tingling down the leg. Let's look at the origin and the insertion of the piriformis. Piriformis actually originates on the underside of the sacrum, under here, and then comes out and inserts in a place that's very difficult to see. It inserts on the inner portion here of the greater trochanter of the femur, and here it is, the medial view of the medial portion of the greater trochanter of the femur. So this is just an exploded picture of what we can't see hidden behind or medial to the greater trochanter. And you can see that by its position here, that the piriformis would be a lateral rotator right here of the lateral rotator of the femur at the hip joint. In other words, it would rotate it outward. It would point your toe outward if this muscle were contracting. Not only that, it's involved in extension. It would kick your leg backward, kick the femur backward into extension. And you can see if you, well, certainly you can see from this angle how it would be a lateral rotator, how it would pull this femur sort of around this way. The next of the deep lateral rotators is the Obturator Externus, or Internus, excuse me. Obturator Internus is this muscle right in here. It sort of occupies the obturator foramen. And you can see how it's in its origin is on the ridge there of the obturator foramen, and it travels laterally out here to attach to also the greater trochanter right here. And its job, obviously, it's another lateral rotator. So we're going to color in here. It's a lateral rotator. It would twist the femur outward. It is also an abductor. So from its vantage point here, at its origination point, right here, you can see how it would, with its vantage point here, and how it would pull back this way and cause the abduction of the femur, as well as external or lateral rotation. Moving on, actually moving backward, that was a mistake. So let's back it up. Certainly is a lateral rotator, but I drew the origin from the wrong obturator foramen. You can see this is the inward part of the obturator foramen, which we cannot see here. So it would be, the origin would be in here somehow on the other side, which we can't see. And it would reach here, then providing the abduction and lateral rotation.